As we enter cold and flu season, the shortage of children's pain and fever medications continues, with shelves sitting empty at many pharmacies right across the country. Health Canada is working on ramping up supply, and we're now learning the shortage could last until December.
Our children have been more sick through all sorts of respiratory viruses and other conditions that were not usual before COVID-19.
With children's medications in short supply, parents are taking their struggle to social media. One mom posting on Facebook that her daughter recently came home from surgery. She doesn't drive and can't locate pain medication in her neighborhood. CityNews has been reporting on this issue for many months now.
Empty for kids. There's nothing.
There's nothing.
Yeah, and we talked to the pharmacists and they said that they're on back order and whenever they're going to get it is when they get it.
According to the Ontario Pharmacists Association, demand for liquid Tylenol and Advil skyrocketed over the summer to unprecedented levels due to the unexpected circulation of viruses.
The manufacturers plan over a cycle of 4 seasons, and that's how they match demand. And when they saw the record levels, up to 300% increase in demand, there just wasn't the capacity to be able to quickly turn around product. And I think that demand issue is not just an Ontario or Canadian problem, it's actually global.
Today, Health Canada released a public advisory on the situation, with the Minister of Health saying the government is doing everything possible to make sure production is ramping up.
I personally spoke to several manufacturers, including Johnson & Johnson, Aeon, and PharmaScience, as well as to associations of pharmacists and pediatricians, to reiterate their urgent need to collaborate to find both a short-term and a long-term solution.
Health Canada also says companies that supply our country have been provided pathways to import foreign products, and it's reaching out to additional suppliers.
So parents can have the medicine they need to take care of their children.
But even though some manufacturers have already ramped up production by up to 50%, it will take time to catch up as COVID-19 infections flare up again and flu starts to spread.
Our expectation is as we get into November, that increase in production will start to have a more steady flow of products. But it will probably take right into December before you see that constant going into any pharmacy or other location where, the shelves they look full.
Health Canada acknowledges the shortage could send more children to the ER and put more pressure on the healthcare system. Parents are being urged to speak to a pharmacist or a family doctor to help identify safe alternatives. Shauna Hunt, City News.